Our urgent care center reopens today after a temporary closure. My thanks to all the UCC staff who were redeployed to support priority staffing needs across our site. Your flexibility in doing this and your willingness to do it are very much appreciated.
We've been at 70% of our pre-COVID activity, which is the provincial goal, but by the end of this week, we are targeting to get to 80% after a lot of work. So many thanks to the team, because it has taken a lot of coordination and efforts to make this happen. All 312 staff that were deployed have returned to their home units. So again, sincere thanks to that group, because your contributions were essential to us being able to manage through very turbulent times.
In a nutshell, in our inpatient areas, we allow 2 caregivers, support persons or visitors at the bedside at any time. The exception to that is our hematology oncology stem cell unit, where the immunocompromised patients are significantly greater. They are asking to stay to the 1 visitor, 1 per day, and only 1 at the bedside. However, we are no longer keeping visitor lists, so those lists don't need to be kept. We aren't doing contact tracing anymore as an organization.
I think most of us expect that we will see a spring wave. Here, the peak is expected to occur end of April, beginning of May for hospital admissions, and it's about a 50% increase to where we've been last week in terms of how many patients in hospital, which would be a manageable wave. It looks like, yes, we are on the trajectory to see that resurgence. Again, if it turns out to be the way as it's modeled here, very manageable from a hospital perspective.
Patient and provider feedback, specifically during the course of the pandemic, I think, for a lot of reasons we heard that the blocking of our ID was a challenge for folks to pick up the other end of the line. So for that reason, really a catalyst for this change. And of course, understanding that other hospitals have gone this direction as well, and that it's seen that positive light as well has really been encouraging. What we'll show for folks, just as an awareness, is the phone number there that's presented, and it'll say Hamilton Health Science or Hamilton Health Sci. There are only 2 areas that will remain blocked, those being the Sexual Assault and Domestic Violence Clinic and the Special Immunology Services Clinic.
High impact workflows describes circumstances where there is a significant shift in the way we will go about our care as we move from our current state into the EPIC world. And we have identified 21 actually of which are considered to be enterprise-wide or corporate-wide high-impact workflows that need to be addressed to allow us to be able to go live and to mitigate risk as much as we possibly can, so that we can, on day 1, provide the most effective and safe care for all of our patients.
In response to staff needs for support, Michelle Cassidy, who is our Healthy Workplace Coordinator in the mental health space, as well as the Human Rights and Inclusion team, have also created space for staff, physicians, volunteers, students to gather in a Zoom environment to share and support one another. This is a space for peer support and connection. It is a space where we can come together and share the impact of what is happening in Ukraine personally and collectively. These spaces will be offered at 2 dates and times in the hope that these offerings are inclusive for folks working different shifts at HHS. The first Zoom space will be on Wednesday, March 30th from 8 o'clock to 9 o'clock p.m. And the second space will be on Thursday, March 31st from 2 o'clock to 3 o'clock p.m. in the afternoon.
Would continue to encourage folks to continue to be prudent in their actions as they go out and about their affairs, in terms of just being careful, knowing that the virus continues to be out there. So thanks all for attending today, and we'll see you again next time.